when we were walking through the sweet potato field, and then with some of the students at the St. Mary's of Bokeh school, and as they were talking about it, I found it fascinating that you said, yeah, you're so there's that emotional point that we've come this far.
Right. Well, until you've had the public health impact, that's when you've succeeded, and until then you haven't succeeded. Even though you've met milestones, and you look back and you say, wow, I never, in a way, I've never imagined that we'd get this far, but still we're not there yet. We have a long way to go in terms of reaching the numbers.
And the public health impact would be what? What needles are you looking to move?
Well, I think the main thing is if vitamin A deficiency is a certain level, say 40% of the population is vitamin A deficient, if you could move it to 20% and attribute that to the introduction of the biofortified crop, then that would be, that's the end game right there. So it's measuring that reduction in the prevalence of vitamin A deficiency, iron deficiency, zinc deficiency.
Children of the biofortification era, having less of those problems. And so in Uganda, where those problems are certainly manifest, you're already seeing some of those public health results here, right? And in the Central and East African region.
Yes, I think we're seeing this particularly with the orange sweet potato, the vitamin A, because we've been working at this longer. With the beans, this has been the second crop that we've been working on, and they have been well received. So when you get people thinking about a balanced diet, including those things that they already have, that's a really big step forward. And we talk about, okay, well, now we need that millet at higher levels of iron because we know that that's used in diets. And so you're right, then you start to see these really positive things happening.
But the finance moves not only from the countries here, but the people at the World Bank and the US and USAID and DFID and those governments to realize that this is really fundamental for all of us, because the impact on the economic activity in countries like Uganda and elsewhere in Africa and the developing world, the impact on their economies. And we heard some people talking about that in Africa it could be anywhere between 2% and 17% drag on the GDP of a country. That has tremendous international implications as well, and those economic implications then eventually hit home in the United States and Europe, in Canada and Japan and Asia and the rest of the developed world.
Right. Malnutrition has a terrible drag on economic development, and so if we can reduce the malnutrition, the economies will grow much faster. That's true.
Mm-hmm.
Well, I think there have been a number of countries that have expressed a great desire to have the biofortified crops in their systems, and we're finding it a challenge to get them in quick enough. There's still some adaptation that has to go on with the varieties, but where there's a will, there's a way, and so we want to be able to find a way to really push this through with the other governments.
I mentioned the private sector, and we've mentioned the national governments, but there are two other very large stakeholders that we want to get involved, or actors that we want to get involved. One are international NGOs. So we've signed a memorandum of understanding with World Vision. They work in 90 countries around the world. They want to integrate biofortified crops into their agricultural programs. We saw today what a great job World Vision is doing here in Uganda with the orange sweet potato and the iron beans. We'll be expanding the number of countries that we're working with World Vision on. And eventually work with other international NGOs as well. The other constituency are multilateral organizations. World Food Program, for example, the Purchase for Progress program, the director of that was at the conference and stated his support that he would incorporate nutritious staple food crops into Purchase for Progress. They're already doing it in Rwanda, they're already doing it in Zambia, and they want to expand to other countries as well.
Excellent. Thanks.